I'm visiting with Dr. JaDean Anderson. Dr. Anderson, what role does exercise play in chiropractic?
Exercise helps patients basically stay fit, and we all know that the more exercise you do, the more healthy you're going to be. It keeps your body active, and within that, the chiropractic adjustments with exercise helps the patient respond quicker to adjustments. Not to say that everyone has to run 6 miles and things of that nature, but just to stay healthy, whether it be a 10 to 15 minute walk every day, will help keep your body active, the joints moving, which is the most important problem with decreasing patients' pain, is staying healthy and active through exercise.
What about stretching exercises, like flexibility exercises like yoga? Can they pull your vertebrae out of place?
They can be helpful, and in some cases they can cause problems by doing too much stretching in the wrong direction, depending on the patient's case and problems that they do have. So sometimes it's targeting an area that is somewhat weakened, and you need to restore the proper strength to the area, and then doing the yoga and stretching exercises will benefit that area.
What about weight training? How does that affect chiropractic adjustments?
Weight training is just as good as walking or running or anything like that, because it's keeping the patient active. What I recommend is not overdoing the amount of weight that you do, and doing it with proper form as well, because anyone that has lifted weights and done an extreme amount of weight in a inappropriate manner knows how quickly it can cause problems with your back. So how I recommend weight training is doing it in the proper form and with the proper amount of weight.
Okay, you mentioned running. How does that affect the spine? Because you're jarring your body with each footfall.
Yep. In some cases, it's just going to be kind of like a mini traumatic event experience over a long course of time. So people that run, sometimes to keep their spine aligned as much as possible, they might need care a little bit more frequent than people that are only walking for 15 minutes a day. So depending on the type of activity you do will obviously change how much stress or strain is put on your spine and your back, and that will affect how often you need to be adjusted or checked.
So exercise is really good for the body, for the spine, we know that, but we also have to be sensible.
Yep. To never overdo anything. I always tell people moderation is the most important. To never overdo anything, whether it be running, walking, or lifting weights.
Thank you.